Okay, 5 minutes on the genetic statement to get a feel for this mind map. The NHS National Genetics Education Development Centre contains great resources for GP registrars, and I've pulled out the learning outcomes and the resources here. There's helpful information on collecting and recording and interpreting family histories. There's a video on taking it, PowerPoint, photographs, etc. Down here there's a useful resource for medical students, and since this is a rapidly developing area, I think it's useful reading for established doctors as well. National Screening Committee, a couple of useful links here. This UK screening portal is a great point of entry and includes videos and other multimedia tools. Clicking just there on GP resources will actually take you to this rather innovative use of the website, where you can either just get a thumbnail sketch of various useful screening tools, and by actually clicking here it takes you into specific resources. Very helpful and user-friendly. As always, hovering on the introduction and UK health priorities will open up these windows, which you can also click and open up to full screen. But let's have a quick look at some of these learning outcomes. Primary care management describes support services such as contact a family. Remember, you can just do that for it to remember to go into this website in the future and allow it. This is a great resource for parents and families, not just professionals. The knowledge base contains a list of common and important conditions, and the fact that we need to know about chromosomal abnormalities, single gene disorders, multifactorial diseases, etc. So if we just show all levels, it'll open this up, and as you can see, it actually gives examples of recessive disorders, cystic fibrosis, autosomal dominant, etc. Just helps us get a feel of what we already know, probably somewhat vaguely in the back of our minds. Obviously, going to the resources or website generic resources at the top of the map, open that up, and having the websites are at the top of the map, and opening that up will help you access a wealth of resources. Obviously, the website section is at the top of the map and contains both these generic ones and specific ones. GP Notebook is a rapid way of getting familiar with a lot of the things in the common and important conditions section. Just opened up some of these other sections so you can just get a feel of how the map's structured. When you're finished with primary care management, go on to patient-centered care. But a much bigger section is the specific problem-solving skills. And here we can see that we're expected to have knowledge of things such as the newborn screening program, bloodspot.org, screening timelines, etc. Well, these are all the links that I've put in based on this particular set of competences that we're meant to have. Remember that the curriculum was often designed before some of these resources were readily available, so the map allows us to integrate what we're expected to know with the resources that are actually out there. In blue, I've sometimes put things which trainers might want to highlight with their trainees, but obviously has applicability for everyone. For example, the ethical aspects of managing patients and families and taking into account the different viewpoints and knowing what to do when it comes to confidentiality or testing children or pre-symptomatic testing. A lot of the resources in both the generic and specific websites at the top help you get a feel for these different issues. So just work your way around the map as you do with the others. One can end with the key messages, or one could start and end with the key messages. And the fact that the structure of the map is similar to all the others makes things relatively straightforward. Thanks for listening.